Okay, John, how do you do?
We've been hanging out for the past hour.
All right, am I just supposed to just jump right into the podcast?
I think. I don't know, man. I don't know if this is like a warm up to like every single one, or if it's like okay, after the first one we kind of like introduce ourselves and then we do the second episode and then the third episode, but then we stay there every other week or whatever we do at the end.
Shh, it's a secret. We batch the content. Welcome to the Move with MOTUS podcast. My name is Dr. Christopher Ellis, and joining me is personal trainer John Williams. We are the owners of MOTUS Personal Training and Physiotherapy. Together, we will discuss any topic you can think of when it comes to training and rehab. From the carnivore diet to hip impingement, you can be sure that all your questions will be answered. Enjoy this week's episode.
So this is actually an interesting one because you talked about, because we're talking about vertigo today, and I remember like the look on your face when you were like, "Hey, I have this woman coming in. She might have this one form of vertigo that is like a super cool. There's like a super easy, super cool fix to it.
Yep.
And you should just watch and like check it out." I don't think she had it.
No, she tested negative.
Yeah, she had something different.
Yeah. That's cool when you see it. So this is called BPPV is what we're talking about. So first of all, dizziness, vertigo. First of all, people are like, is it dizziness or vertigo? I'm like, well, it's the same thing. It's just an adjective, basically. So there's many different forms of it. And usually the first thing I find out is, okay, what is the dizziness like without saying the word dizzy? Because you'll find out some people think it's like room spinning dizziness for some. That's what I hope for. For others, it's lightheadedness. For others, it's like double vision. For others, it's feeling like you're off balance. So there's a lot of different ways.
And I would imagine a lot of those are different symptoms.
Yeah, 100%. And, there is overlap with some of them, but that's kind of the most important thing is what are the symptoms? Like how, what are you truly experiencing other than just saying I'm dizzy? So BPPV is the one, if you've heard of, if you have crystals loose in your ear.
What is that acronym? Do you know?
Benign paroxysmal positional vertigo, which just means when you change your head position, you get the spins, basically. So it's pretty common, actually. And as a therapist, it's super rewarding because usually it's a one-time treatment. Every now and then a two-time treatment. And they're better within 24 hours, which is amazing because I don't know what it is, but like a lot of the medical community doesn't seem to know about it. So what these people do is, they turn their head, they lay in bed, they roll to one side, and suddenly the room is spinning like they're hammered drunk. And they freak out, they go to ER, and they're just given a prescription of meclizine, which is an antihistamine, which basically just makes you feel like crap. By the way, one of the side effects is it makes you nauseated and you can vomit, which is kind of like what it's trying to cover up. So that's just kind of interesting. So basically everyone's like, oh, it just made me exhausted and I just couldn't do anything. So that's the medical answer to it. And it's only trying to mask a symptom. It doesn't really get to the heart of the problem. So let me go into that a little more. So in your inner ear, which is a separate function from hearing, by the way, because everyone's like, oh, my hearing's fine, but, those things are separate. So inside the inner ear, you have 3 semicircular canals on both sides. So 3 on the left, 3 on the right. And they have different orientations. There's an anterior, horizontal, and posterior canal. They're filled with fluid, and at the base of these canals is what's called a cupula, which attaches to a nerve. On top of the cupula, there's these little crystals, or otoconia, they're really called. And
Dude, what are they actually? You call them crystals, but do you know what they actually are?
It's mineralized something or other, calcium, or I don't know, something rock-like. I don't.
Something crystal.
I don't. Yeah, I don't really know, because that doesn't really matter. So they.
Well. To you right now.
Okay.
Because you don't know what it is.
I'll look it up for you, John.
Yeah, thanks.
All right. So they sit on top of the cupula, and then they basically anchor these hair cells. So these hair cells stick up, and when you turn your head, fluid drags on the hair cells and pushes them one direction or the other, and it's kind of a push-pull. So what one ear is doing, the opposite is happening in the other ear, right? The inner ear. And then that sends a signal through the cupula to the nerve, and the vestibular nerve, goes into your brain and tells you basically where you are in space, and that's how you stay balanced. Got it so far?
I have to just say one thing before we continue.
All right.
The human body is
amazing.
Incredible thing.
Yeah. And this is like such a super tight function. There's a reflex involved too, we'll get to. It's like it could, the human brain is such like a highly tuned engine. It's amazing. When I used to DJ, I used to think about that because when you're always trying to match the beats, and if you're off by your beats by like just a sliver, everybody in the room can hear it. It's so obvious. It's just like a 0.008th of whatever. If it's that much off, it's very noticeable. Like that's how tight our systems are. So, anyways, what can happen with BPPV is those otoconia, those crystals, for whatever reason, we don't fully understand it, get knocked off the cupula, and they start to float around inside the canal, and that'll make you super dizzy like you're drunk. And there's a treatment that's super effective. You have to roll your head in a certain maneuver, a certain way. You have to know all the angles too, and it puts the crystals back to the cupula where they belong, where they get reabsorbed. And usually within 24 hours, you're better. So,
But you even think the effects happen pretty immediately. Like, oh, wow, I can already.
So, yeah, there's a technique. It's called the Eppley maneuver or canalith repositioning treatment. So I take them through. It takes about 15 minutes. Now let them sit for a few minutes, and then you do it a second time. And usually by the second time, okay, so I go in like the very first position, which is like laying down with your head off the table. They're usually like grabbing onto me for dear life. You can see their eyes twitching like crazy. That's called nystagmus. That's the sign, basically. Then it usually subsides within a minute or so. But they're like ready to throw up. I always bring out a puke bucket just in case. I haven't been puked on yet, but I know it's coming. But then you take them.
People have, though.
Yeah, definitely. It'll make you vomit. It can make you vomit. So then you take them through it a second time, and usually by the time you do the second one, like, oh, that's gone. So, I mean, you're talking immediate effects. So here's the thing. So when I was in grad school, we do rotations. One of my rotations was in a hospital, and I saw this woman who had this, and luckily the therapist recognized it and knew how to treat it because that woman was supposed to go into surgery that day to have her vestibular cochlear nerve transected, which would leave her with a Bell's palsy for the rest of her life, when this is like a 15-minute treatment. That's non-invasive, right?
You can't see my face over audio, but I widened my eyes and my mouth hung open a little bit in awe at the absurdity.
Yeah, and actually, one of my buddies is married to a PA. When she was in school, she learned about this whole thing, and in the presentation that she was given, it said, old treatment, Eppley maneuver, does not work. Prescribe meclizine, like, it's crazy.
And then put ice on it.
It works for me like 100% of the times. It's the most effective treatment that I can do.
One of the things we talked about in one podcast was this weird, like, hip movement that it was like an ancient Chinese something. Didn't we talk about this?
Oh, like the massage technique?
Yeah.
Yeah.
It made people's hips feel better, something like that.
Yeah, where you kind of like rock their hips back and forth, kind of oscillate the hip.
Yeah, and they were like, well, somebody asked, like, why do you do this? And they were like, we don't really know, but it works.
Yeah, I got that from Mike Reynolds. I did his program, and that was what he asked them because he was observing. And they're like, well, we don't know, but we know it works.
And that's one of the questions here is, like, how did somebody come up with this? Or was it like all of a sudden somebody just held somebody's head some weird way? Like, oh, that made this a lot better.
Oh, I doubt that this came out by accident. I think this came about by studying the anatomy, and you can get a whole vestibular certificate, which is basically treating this type of stuff.
Gotcha.
There's books, textbooks written on just this one topic.
Mm-hmm.
So, so if you get the room spinning dizziness, go see a physical therapist. Don't go to the ER, all right? Especially
for
if it's
most things,
physio first, period.
go to your physical therapist first.
Yeah,
aches and pains, weird things happening with your body, most of the time, go to your physical therapist first.
Yep.
I can't think of too many things unless, like, you're bleeding out.
Yeah, acute wounds or like a fracture or something like that.
Yeah, like a heart attack.
Yeah.
But I don't know. There's any, like, weird nerve pain, numbness, tingling, aches, pains, dizziness. Most of that stuff is better treated by a physical therapist who understands biomechanics as well as physiology.
Well, we go through differential diagnosis too, so we know all the red flags and yellow flags of cancer and some of the more malignant type of things. So we're pretty good at catching stuff and saying, okay, this looks more than mechanical pain. Now you need to see a physician. We're pretty good at basically filtering that stuff out.
And I don't mean to demonize anybody, but everybody who has a job to do, wants to do more of that job.
Yep.
There's incentives aligned. So if you have knee pain or you have dizziness and you go to a surgeon, their job is going to be to do surgery and solve the problem.
Yeah. Well, I always say, like, look at the tools in their toolbox of the provider. So I'm going to try to fix things with mostly exercise, some manual therapy. If you see a surgeon, needle, knife, and pill is what they have in their toolbox. So you have to keep that in mind. And, I also don't want to demonize anybody. I think there's tons of practitioners that are very responsible and reliable, and they're just trying to do the best by you. Part of it, though, is a function of our system, because of insurance and cutbacks. And basically, a physician's lucky to have like 7 minutes with you. So they're like, okay, here's your symptoms. Here's the pill that I know to give you for these symptoms. Done. Next. That's just kind of our system right now, unfortunately.
And the best people you can meet in this life are the people who own businesses who are willing to refuse you service because they can't do that job.
Yeah, absolutely.
Like, when somebody comes to me with excruciating pain in a specific area that I don't know anything about, I'm not going to work with you.
Yep.
And I'm going to give you a phone number of a person that I know can help.
Yeah, I like that. That's right. So that's one of the big advantages we have as physical therapists. It depends on where you are, what setting, but like I have 1 hour appointments, sometimes hour and a half appointments with people. So I can really like dive deep into their history and get a thorough evaluation, and we talk about things like that can add to pain or add to things like this, like the psychosocial stuff like sleep, nutrition, and whatnot.
And I want to say this too. For anybody who deals with these sorts of issues, a guy like Dr. Chris, it's not particularly inexpensive to work with you. But don't think of it as a cost. Think of it as value added to your life.
Yeah, it's a self-investment. But, actually, if you look at the real numbers, I'm actually cheaper than your typical insurance-based PT because unless you've met your deductible. So say you go see a PT in an insurance-based clinic, even if they're fully in network, you're going to have a copay. I've seen copays as high as $77 a visit, right? You're going to probably see them 3 times a month or 3 times a week for 4 weeks, probably for 2 months. So that's 24 hours of your life. Right, and they're gonna submit all that stuff to insurance, and chances are you haven't hit your deductible, and then you're gonna get like a surprise $3,000 bill at the end, plus 24 hours of your life, plus whatever your copay is times 24. Whereas, I'm gonna charge you up front, real clear. There's no, nothing that's not transparent, and I'm usually gonna get you better in 6 to 10 visits.
Yeah.
So it's, really I save you time and money.
Yeah. Hey, so I want to talk about just people who like chronically get vertigo.
Okay.
Is that a different thing than the thing we just talked about?
So let me kind of wrap up the BPPV thing. So one thing that does cause it is like blunt force trauma to the head. I not to laugh, but there's one thing that happens to people all the time that it's like probably the number one cause of this is you open your fridge and you bend down. No, you open your freezer and then you bend down, you open your fridge, and then you stand back up forgetting that the freezer door is open and you hit your head on the freezer door. That's like the number one reason that like I see knocking. Yeah, you've done it?
2 days ago.
Did you? Yeah, it's super common for whatever reason.
It went up, I was like,
it's like a flaw in the human brain. I don't know. But that will definitely knock the crystals loose. I've seen things like pressure changes, like something like a recent flight or scuba diving. Sometimes that precedes it. Respiratory infections seem to precede it too. So we don't fully understand it, like I said, but I just thought that was kind of comical, that mechanism of injury. So
just everybody get your freezers on the bottom.
Yeah, exactly.
If you don't want to have to deal with this problem.
So one of the bummers is if you've had this once, you're more likely than the average person to get it again. So I don't know if I'd call that. Baby. I wouldn't call that chronic. I'd say it's just acute flare-ups, repetitive. So there are lots of other forms of dizziness. I do want to talk about one in particular that sort of coincides with BPPV, but I'll get there. So there is like Meniere's disease. So when I was talking about the semicircular canals, there's actually 2 layers.
Why are you so tan?
4th of July, I was out by the pool all day barbecuing. Yeah.
Anyway, continue on.
Yeah, nice. So anyways, there's 2 layers of fluids, and there's a gradient. And if there's an imbalance. I think one has more sodium, one more potassium, if I remember right. If there's an imbalance there, that can cause Meniere's disease, and that can also cause room spinning dizziness. But that will usually last like days, and you'll get like drop attacks where you just fall down. So that one's sometimes medically managed, or also managed through diet. That one sounds to me a lot like an electrolyte imbalance. There are some nasty things too, like neuromas, a tumor that can happen on your like the vestibular nerve. So you want to rule those things out. There's one called a superior canal dehiscence, where a piece of your bone is just sort of congenitally missing near the inner ear. You'll get these weird symptoms like when somebody drives by with that bassy truck, you'll get super dizzy. Why do
people do that to themselves? Because you can hear that outside the car.
Yeah.
Imagine what the environment is like inside the car.
I've never understood that. I hate that.
I barely even like going to clubs, let alone locking myself into a really tiny version of one, but then louder.
Yeah, you just hear the door rattling and all the change in your car rattling, and I don't get that. So there's a paralymphatic fistula, which is kind of similar to Meniere's disease. I actually did it to myself once while scuba diving. I kind of forced myself down before my ears weren't equalized. That caused me some pretty nasty dizziness, but it resolved. So
Did
there's
it
a whole
happen
bunch.
when you were in the water?
No, it was like that next day. I was miserable. It felt like I had popped like my tympanic membrane. Just the ear felt full of fluid. So, but the other one I really want to talk about is the VOR hypofunction. So, because this tends to happen with BPPV. So the VOR mechanism is a vestibular ocular reflex. So your ability to look at something and move your head position and keep your gaze stable on that is due to this reflex. So it's kind of this push-pull. He's turning head side to side.
Yep.
Right? There's a push-pull mechanism that happens. It's kind of similar to what I was talking about earlier. And your brain basically calibrates where your eyeball should be based on the rate at which you turn your head. And this thing has to be perfectly in sync from left to right.
It is pretty impressive. If you watch yourself in the mirror, like turn your head and just watch the eye like track perfectly.
Yes, and actually that's one of the signs of a VOR hypofunction. I'll take a pen and just have you track it with your eyes, and usually what you'll see is it goes nice and smooth to one side, and then when it goes to the other side, it kind of clicks. And we call that saccades. That's the name for it. That's a sign of a hypofunction. So anyways, the reason I bring this all up is because with BPPV, turning your head is terrifying because it might make you vomit. So all these people walk around like Batman, like in the old Batman.
Think of the other issues they would get as a result of that.
Oh yeah, the neck stiffens up, you get headaches, all stuff like that. So a lot of people will just like live with this for like years and not do anything about it. And then by the time I get to see them, they've developed a VOR hypofunction. It's kind of like a muscle will atrophy if you're not using the reflex much. It kind of becomes miscalibrated.
Wow.
But the other good news here is that it's really easy to fix. It takes like a month or two, where you just basically have to. I'll give an example of one exercise. Lots of ways to progress it, but you just take a Post-it note, you write the letter B on it, stick it on a wall, sit about 6 feet away, or wherever it's in vision, and you slowly turn your head side to side, like you're saying no, for about a minute, keeping the letter B in focus. Then you do the same thing with an up and down motion, like you're saying yes. It has something to do with the straight line and the curved line. It's enough of a visual challenge.
No bullshit.
No, that's part of the way to progress it. You make the background busier, and you can do things where the target starts to move by holding the letter B and moving it opposite to your head. So there's lots of different exercises around this, and like I said, it usually takes about a month or two to resolve.
Any color sticky note that works better than others? Serious question.
I would start off with white, on a white wall, or whatever.
Who has a white sticky note? They're always colors.
Okay, do yellow. I don't know. Maybe match it to whatever color your wall is. Start off simple and progress to hard. God, yeah, ask tough questions. But yeah, that's the most common thing I see. BPPV and then VOR hypofunction, like sort of a secondary result. So, come see me.
There we go. You can fix everything, including the weird things that you wouldn't think a physical therapist could fix.
Yeah. Not every physical therapist does this. This is falls under kind of the neuro category. There's lots of like sort of subsections of physical therapy, like pediatrics and things like that. So this, I think this was really spurred on by that episode I mentioned in the hospital where this woman was about to have surgery, and the physical therapist was like, "Oh no, I got this." I think that's what really triggered my interest in it. So,
Yeah, of course.
but I think that's enough on vertigo. Any other questions you have about it?
Nope. Next episode is going to be on why you shouldn't wear pants, and they're actually killing your circulation.
Interesting.
Yep.
All right. I definitely will see you next week, John, and not in a few minutes.
Okay.
Later. Do you have unexplained pain? Or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great way to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's liver function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It's sent to you with free shipping, and you get results in 2 to 5 days, no physician referral needed. Use the code DPT20 for 20% off. Go to letsgetchecked.com and use the code DPT20. Thanks for listening to our podcast. If you have any questions you want answered, find us on Instagram at MOTUS Naples or send us an email. You can fill out a contact form on our website, which is motusnaples.com. Make sure to check out our blog and our shop as well, where there are downloadable programs that we'll continue to update. This is the Move with MOTUS podcast. We'll see you next week.